Having discussed all the cocci, let's begin with our discussion of the bacilli. As I've told you earlier, all the bacilli are gram-negative. So all the bacilli that we have are gram-negative bacilli except for a list that I'm going to discuss with you called McDonald's. And McDonald's are going to be the gram-positive bacilli. So what is McDonald's? M for the most famous organism of our country, that is Mycobacterium. Then A and C are together two spore-forming organisms, and that includes anthrax and Clostridium. So repeating, anthrax and Clostridium, both of these happen to be the spore-forming organisms. Then let's go on further. What is D? And I'll take both the D's together. Diphtheria and non-diphtheroids. So we talk about diphtheria and all the other diphtheroids, all of these come under the gram-positive variety. Anything to do with D and D, diphtheria. Then I'm going to take up the two very similar. What is N and A? What are the filamentous organisms that we have? Nocardia and Actinomyces. What is common amongst them? Both of them are filamentous. And the one that is left, that is L, that is going to be Listeria. So try to make groups. That is how you learn a mnemonic. So M for Mycobacterium, A and C together are going to be the spore forming, that is anthrax and Clostridium. D and D we will take together, diphtheria and diphtheroids. Then Nocardia and Actinomyces, the filamentous ones. And L for Listeria. All of these, McDonald's is gram-positive. Actually, in the bacilli, I'm starting first with the family of McDonald's and then I'll go on to the others, right? So let us begin our story and talk about the diphtheria and the diphtheroids first, and that is the chapter that we are going to start with. When I talk about Corynebacterium diphtheria, there is something very famous about it because this is known as the Kleb-Loeffler's bacillus. Now, please note, everything about Corynebacteria is going to be Loeffler associated, whether it is the name of the Corynebacteria or even after some time I'll tell you the medium. Everything is Loeffler associated. I've already told you it's a part of the mnemonic McDonald's. This means they are gram-positive. And after that, it has nothing special about it. No motility, no sporing, no capsule, nothing special. The only special point is that it is a part of the mnemonic McDonald's. That's about it. So diphtheria, diphtheroids are gram-positive. So now let me tell you what other than, it's not just Corynebacterium diphtheria. There are many types of Corynebacterium that you have. One is definitely Corynebacterium diphtheria, which is next 20 minutes of your chapter. But before I go on to that, there is 5 minutes that you need to give to the others also. Let's finish those off. Okay? We anyway always try to do the smaller topic first. So the others include Corynebacterium, ulcerans. Now there's a way of learning it. See, ulcerans, what does it tell you? If I write ulcerans, you get a U and you get an L. So the U tells me that the name of the organism is ulcerans, and L tells me that the involvement that you see is involvement of lungs. So simple na, ulcerans mein you pick up U and L, U for ulcerans, L's for lung. The next name, Corynebacterium, look at what I'm writing over here, pseudotuberculosis. Corynebacterium, pseudotuberculosis, because here also I will pick up these two alphabets. What is P and what is S? So P tells me that the other name of this bacteria is going to be the Priess-Knockout bacillus, and S for this doesn't cause infection in humans, this causes infection in sheep. So repeating, P for Priess-Knockout bacillus and S for sheep, that is pseudotuberculosis. Coming to the last one, that is a case of Corynebacterium minutissimum, and this Corynebacterium minutissimum gets you a lot of questions when it comes to dermatology. So kya hai? Corynebacterium minutissimum, I'll write it with a red color because this tends to show you the very famous reddish rash. Matlab, can I call it erythrasma? I call it erythrasma because this is going to be a red rash that is present where? It's present in all the folds of the body. Folds means it could be present in the axilla, it could be present in the groin, in the gluteal region. So wherever there are folds of the body, you're going to get a reddish color rash. Guys, this might have reminded you something in dermatology. Not only is a rash red in color, but in dermatology, don't you look at every rash under the wood lamp examination? So tell me, under the wood lamp examination, this is gonna give a coral red color under wood lamp examination. Again, another red coming up your way. It is coral red fluorescence or color under the wood lamp examination. I want to ask you something, guys. Tell me, why is this color coral red if they ask you the reason? So if I ask you now, what is the reason for the coral red color with Wood's light that you get on erythrasma? And the reason is there's a pigment called coproporphyrin 3. This coral red color is due to Coproporphyrin 3. This is just a dermatology correlation that I wanted to do. So I've got it on a separate slide. But going back to my microbiology, and you'll see there'll be minor places where I'll skip out of micro and path and I'll always go to some other subject, but then I come back making you realize that you're still on one subject and you need to make a flashcard of one thing. So ulcerins mein you're gonna pick up U and L, which will tell you U for ulcerins, L for lungs. In pseudotuberculosis, you'll pick up P and S, presnocard and involvement of sheep. And minutissimum is red rash, coral red fluorescence that you get under Wood's light. And why is the coral red color? Because of coproporphyrin. You're not over. What all did I teach you? Ulcerins, pseudotuberculosis, minutissimum, all of them have something in common. And that commonality is that all of them are non-lipophilic. Ulcerins, pseudotuberculosis, minutissimum. This means you will ask me which are the Corynebacterium which are lipophilic. I have that, and that's a PYQ. I'm going to make you discuss PYQs at the end. The PYQ is which are the Corynebacterium, these weird sounding, jo bach gaya, Jacquium and Urealyticum. These are the ones which are going to be lipophilic. But what do they cause? See, the Jacquium one is usually seen and associated with immunocompromised individuals. And this is very famous for causing prosthetic valve endocarditis, right? It is useful for, or it is implicated in causing prosthetic valve endocarditis. That is the only question that you can get on it. Whereas Urealyticum, see, anything that has urease or urea related ability causes one stone. Like Proteus bacteria, I'll tell you in a while, Proteus also has urease ability, so it causes one stone, and that stone is the Struvite stone in the kidney. So remember this, Urealyticum also causes Struvite stone. Bas ek question hai, Jacquium and Urealyticum both are what? They are lipophilic. Jacquium is going to involve the heart, prosthetic valve endocarditis, and Urealyticum is going to involve the Struvite stones, right? Now let's move forward. All said and done. ये तो हमारा छोटा वाला topic था. Done in 5 minutes. छोटा वाला topic side. Now let's come to the main one, that is Corynebacterium diphtheria. And you know, as if I ask you a common sense question, that before I go into the details, what does Corynebacterium diphtheria release? You say, ma'am, diphtheria toxin. इसमें कोई rocket science नहीं है. It is going to release diphtheria toxin, and diphtheria toxin is not just released by Corynebacterium diphtheria. Let's start your story from here. Diphtheria toxin is produced by DUP, means Corynebacterium diphtheria, of course. But you remember the other species, U se kya tha? Ulcerins, and P was for pseudotuberculosis. They also release diphtheria toxin. So that diphtheria toxin is produced by a lot of other organisms like DUP, all Corynebacterium, diphtheria, ulcerins and pseudotuberculosis. So what does this diphtheria toxin do? Please note, it goes into all the cells except red blood cells. First thing, first question. Second, it is phage mediated, tox gene mediated. So simple na, diphtheria toxin would be what gene mediated? Tox gene is responsible for the toxigenicity, but phage mediated. Phage is what? Bacteriophage. Means if it has to go from one bacteria to the other. For example, if this is a Corynebacterium diphtheria, you say, ma'am, iske paas to tox gene nahi hai. If it doesn't have tox gene, this means it's not going to have the toxin. It is non-toxigenic. Whereas on the other hand, if there is a Corynebacterium diphtheria over here and this has the tox gene, you'll say, ma'am, ye to danger hai. This is gonna have the toxigenicity. Can this tox gene get transmitted somehow? Can that toxigenicity be given? Toxicity can also spread, yes. And that is by a bacteriophage. So they are phage mediated. And that occurs by something known as lysogenic conversion. And come on, you cannot say you don't know what is lysogenic conversion. You've read it in your general microbiology. I've given so much of time to that. We all have read it, that lysogenic conversion ka ek mnemonic tha. Can you revise that? So can you tell me which are all the toxins in bacteriology which are going to get transmitted by lysogenic conversion? I have given you a mnemonic over there. Kuch yaad aa raha hoga. A, B, C, D, E. Guys, there is only one way of doing microbio. Revise, revise, revise. Go to the next chapter, revise the mnemonics of the previous chapter. It requires genuine hard work to do this chapter, to do this subject. It's just hard work and patience. So we'll revise. Toxins which are associated with lysogenic conversion, A, B, C, D, E. What is A? The A and C of Streptococcus pyogenes. What is B? Botulinum toxin. C is the cholera toxin. D, you are anyway reading over here, diphtheria toxin, and E for enterohemorrhagic E. coli. The same slide I have taught you way back in general microbiology also. So A and C of Streptococcus pyogenes, B of botulinum, C of cholera toxin, D of diphtheria toxin, and E for enterohemorrhagic E. coli. All of these are associated with lysogenic, matlab bacteriophage hoga, diphtheria toxin. That is why I am studying it over here. So number one, who determines? The tox gene determines. Who transmits? Bacteriophage transmits. Is it also mediated by the levels of something? Yes, it is also mediated by iron. So does iron have a role in the toxin production or no production? Yes, it does. Iron has a very, very important role out here. Okay. So now what does this diphtheria toxin do? You've told me diphtheria toxin is a toxin which is going to cause the disease. It has two fragments. All the toxins that we talk in bacteriology are going to be bipartite. They are going to be bipartite. They are going to have, obviously there are exceptions, but abhi ke liye there's going to be bipartite. All of them are fragment A, fragment B. Always remember A is going to do the real action and B is just going to do the binding part. That is the mnemonic that I have learned. A will do the action, B will do the binding. So if they ask you which helps in binding to the cells, which helps in attachment or binding to the cells, it is fragment B. But who is doing the real action? And the real action is that there is going to be ADP phosphorylation. Now listen to this very carefully because another mnemonic is coming up your way. There's going to be ADP phosphorylation of EF2. If you are really into full forms, EF2 means elongation factor 2. Varna nahi needed hai, theek hai? ADP phosphorylation of EF2, and whenever ADP phosphorylation of EF2 occurs, the protein synthesis is going to be inhibited. There's going to be an inhibition of protein synthesis. So basic concept, starting and ending. How does the diphtheria toxin work? It works by inhibiting the protein synthesis, right? So now you will ask me that which are all the organisms which are going to work by inhibiting the protein synthesis and or decreasing the protein synthesis. So I have kept a simple way. See, best, the mnemonic that comes from the title is the best mnemonic. So which are the ones which decrease protein synthesis? D, P, S. That's your mnemonic. The toxins which act by decreasing protein synthesis. So D se kya hua? Diphtheria toxin. Now P pe aake you'll be like, ma'am, P se Proteus bhi hai, P se Pseudomonas bhi hai. So pick up the next alphabet, P and S. P and S will remind you of Pseudomonas. So this is the exotoxin of Pseudomonas. Then S alone will tell you Shiga toxin, and ek E. coli mein hota hai Shiga-like toxin. Shiga-like toxin known as verocytotoxin. So S and S means Shiga toxin and Shiga-like toxin. Repeating, all of these are going to act by decreasing protein synthesis. D se diphtheria toxin, P and S together means Pseudomonas ka toxin, S and S means Shiga and Shiga-like toxins. They decrease the protein synthesis, agreed. But how do they decrease the protein synthesis? So the first two that I've mentioned, did I just tell you that they are going to cause ADP phosphorylation of EF2, so their effect is going to be on EF2? Yes, they inactivate EF2 and that is how they decrease the protein synthesis, act via EF2. The other two that you have, the Shiga ones, are going to act on 60S ribosome. They cleave 60S ribosome, and by cleaving 60S ribosome, they inhibit protein synthesis. So the end result is the same, but how you reached there is different. So for the first two, you reached there by affecting EF2, and for Shiga, you have reached there by S. Shiga S. 60S ko cleave kara. That is how you decrease the protein synthesis. So all your toxin related work is done. But now from this toxin, I want to make a vaccine. Can I do that? Yes. From the same diphtheria toxin, if I keep it in an acidic environment with formalin, what I'll get will be a toxoid. And I know toxoid is used for vaccination. So simple, whose diphtheria toxin will you take? What is the strain that we usually use? And you know all these strain wala questions, inka favorite questions hota hai, right? The Park-William 8 strain. So you will take the Park-William 8 strain, you will take the diphtheria toxin from air, you will keep it in formalin and acidic environment, it will change into a toxoid, and then you will be using it for vaccination. I will talk about vaccination in a while, but yes, definitely we know that DT nahi dete, we always give a combination of DPT, hai na? So we'll come to all of that vaccination story in a while, but first let's talk about what exactly does diphtheria do. What is diphtheria? The incubation period is seeming to be very small, that is 3 to 4 days. The transmission is going to occur with the help of secretions. So this means there is droplet infection. Means when you will treat the patient, you will need droplet precautions. Keep that in mind. and the source is going to be all of us. So anytime you come in, you have a patient of diphtheria, you had to maintain droplet precautions because humans are the source and secretion se hoga. So what are the different forms of diphtheria that we have? The most common form that you have is the respiratory or the faucial diphtheria. Let me show you a picture of this respiratory or faucial diphtheria. You can see there is a pseudomembrane that is present in the soft palate and the mouth region. So that is why we said it is respiratory. See, if it's present over the larynx or the soft palate, it can cause a problem in the respiration. So this is going to be the respiratory or the faucial diphtheria. What else? The celebrity kid. The kid's picture comes in every GT, every subject-wise test and every main exam also. And that is lots of lymph nodes are over here. So this is going to result in bull's neck. Remember, these two pictures have come in almost every exam from FMG NEET to INI. Every exam. So pseudomembrane and bull's neck, that is a part of the respiratory or the faucial diphtheria. That's why bull's neck. Other than that, there is a cutaneous and a systemic form. Cutaneous, of course, is going to be ulcers, and systemic means it can involve anything. It can involve the heart, it can involve the nerves, it can involve so many other organs of the body. So simple. Respiratory mein respiratory, palate, neck, those regions. Cutaneous mein skin, ulcers. Systemic mein kya kya? So if you ask me what are the complications, as I said, heart and brain are the most important. So heart may, of course, there is going to be myocarditis, which occurs by the 7th to the 10th day, and that is the most common cause of death. 7th to 10th day tak myocarditis hoga, that is going to be the most common cause of death. And can there be something neurological? Yes, there can be neurological involvement, which is in the form of oculomotor paralysis. Oculomotor paralysis is known, and from oculomotor paralysis, however, the good news is that the recovery tends to be better and it tends to be spontaneous. You really don't need to give too many therapies for it. But myocarditis is deadly. Myocarditis marega, that is going to be resulting in the most common cause of death of diphtheria. Then there are some minor complications. It can involve the blood. So blood involvement hoga, so there will be decrease in the platelet count. It can also involve, the obstruction can happen because respiratory hai na, so asphyxia can happen. These are minor things. Ye yaad karo, nahi karo, your wish. But these two, myocarditis marega, that is most common cause of death, and neurological oculomotor paralysis will be spontaneous recovery. Should we go into the diagnosis and treatment? Let's begin. Where should I take the sample from? Let me consider the most common diphtheria. Let me consider this respiratory faucial diphtheria. Will you take a sample from the membrane? Nahi. This pseudomembrane is made up of all necrotic debris. What am I gonna see in debris? Nothing. Dead cells. Dekh ke kya milega? You don't want to see dead cells. You will remove the membrane and take the swab from beneath the membrane. So what you're going to get is definitely going to be 2 swabs from area under the membrane. Got the concept? Why are you wanting to see dead cells? See the organism under it. So area under the membrane. And what do you see under the microscope? Firstly, diphtheria, McDonald mnemonic, gram positive. Gram positive bacilli means it's gonna be purple. Yes, it is. And it's a little different. It's showing you lots of letters. It's showing you the V shape. It's showing you this L shape. I know V and L because that's the alphabet chain that I know, A, B, C, D. But actually this looks like a Chinese letter appearance. This is a Chinese letter or a cuneiform appearance. You'll say, why? Why are they all joined in random, random alphabets? Because if this was one bacteria, mitosis hua, 1 divided into 2. So they should have become like this. Divide hua, but did not separate. This 1 divided into 2, but did not separate. So this is a kind of a snapping division. Please note the reason for the Chinese letter or cuneiform is the snapping division. So you saw this and then you saw, okay, gram positive bacilli, but again I'll zoom in and show you that, do you see that the ends are, a little more bulbous? The ends are looking more prominent. So kya hai? What is at the ends that this bacteria has? Poles pe kya hai? It has the very famous volutin granules. Everyone first learn all their names. Volutin is fancy naam. Similarly, another scientist, they're also known as Babes-Ernst granules, fancy naam. What are the real names? Bipolar granules, because I am seeing that these granules are noted at the poles. They are seen at the poles. So bipolar word is definitely making sense. Then we have, they are also known as metachromatic. What is metachromatic? That I'll explain in 2 minutes. Okay? So remember, volutin, Babes-Ernst, bipolar and metachromatic are the 4 names for the same thing. But hota kya hai? These are going to be made up of polymetaphosphate. These are made up of polymetaphosphate. If you want to say it in simpler words, Phosphate matlab this will help in ADP ATP, means it's a form of energy. They've just given energy a very fancy name. So it is made up of these bulbous swellings that you have na, isme energy reserves hain. That is what God has given it. So now zoom in and see. Can you all notice that exactly how I told you? For example, if this is a particular organism, what is the color of the organism that you have? Try to correlate it. Color is green. And what are the ends? The ends are purple. देखो ends पर है. Ends पर मतलब bipolar. That is why you were calling it bipolar granules. ठीक है. So now what is this stain? पहले let me tell you the stains, guys. What is your plan for Wolutin? What is your plan for Valentine? ठीक है. What is your plan for Valentine? So my plan for Valentine, very sad plan that we are making microbiology plans for Valentine. But please remember there is something known as the Ponder stain. There is N for Neisser stain. There is A for Albert stain. And there is L for Loeffler methylene blue. Right? So everyone first learn what are all the stains that you have for Wolutin granules. So what is your plan for Valentine? Plan for Valentine, sad medicos wala plan that we are doing this mnemonic. Ponders, Loeffler methylene blue, Albert and Neisser, out of which now they are saying Loeffler methylene blue is said to be the best. But ye photo Loeffler methylene blue ka nahi hai. This picture is a picture of the very famous Albert staining. So that is the question that they are going to ask you moving forward. What is Albert stain? You've seen this PYQ many times, and abhi tak this much you've understood. Organism had to be green and something had to be purple. Ma'am, you're supposed to have something green, something purple. So you know what does it have? It has two solutions. Please note, it has two solutions. One is known as Albert solution 1 and the other is known as Albert solution 2. Okay? Albert solution 1 is going to contain the two colors, the green color and the purple color. Let's start with the purple color first. Main focus on the granule. So purple color is actually going to be toluidine blue. It's going to be toluidine blue and the green color is going to be malachite green. Right? And what does Albert 2 have? Albert 2 has something in between. Albert 2 basically has iodine. So what did I learn it as? Albert 1 and 2 milakar. If they say how will you stain? You will say, ma'am, common sense. First you'll put Albert 1 solution, that will have the blue and green color. Then you'll put Albert 2 solution, that will have iodine. Do you think examiner is going to ask you this question? First add Albert 1, then add Albert 2. I mean common sense. Examiner will give you these three things, that these three bottles are present separately. How should you now add them one by one? And if that situation comes, your mnemonic is TIM. What is it? That first you add toluidine blue, then you add iodine, then you add malachite green. If one by one you have to add, you will follow TIM. If you have prepared solutions in your lab, you will add Albert 1 followed by Albert 2. But did you notice something very essential over here? I am saying toluidine blue, blue, blue again and again. But here I am saying the Wolutin colors have got a purple. Go back to your pathology, I have taught you this. Some other color it has, some other color it is giving. It is like that two-faced student of your class who says, "Arey, kuch nahi padha, I have not studied anything," but then on the day of the exam, in front of the examiner, he's giving all the answers and he's gonna top. Same way, he has a different color, blue color, he's showing a different color, that is purple color, that is known as metachromasia. You understood the concept of metachromasia? Metachromasia means I have a blue color, but I'm going to show you a purple color. So toluidine blue is a metachromatic stain. It has a blue color, but the color that it's going to show is going to be a purple color to the Wolutin granules. I hope everyone's understood, because if they don't give you the image, they will ask you that what is the color of the organism. So remember, the organism is going to be green. So if I give you a fill in the blank, I don't give you this picture. I say on Albert staining, organism comes dash in color and the Wolutin granules are going to come dash in color. So you'll say simple. Organism is green in color and the Wolutin granules are purple in color. How did they turn purple? By this two-faced stain, toluidine blue. All your Wolutin granules are almost in one slide. Abhi ke liye jaldi se revision. Wolutin, Babes Ernst, bipolar, metachromatic. Same thing. They are nothing but energy polymetaphosphate. Stains. What is your plan for Valentine? Plan. Out of which Loeffler methylene blue is best. Picture jo diya hai, that is going to be of Albert. Under Albert, I can see the organism has come out green in color and the granules have come out purple in color. Why have they come out? There is Albert 1 and Albert 2. Aise pucha to fine. If they ask me individually, I will add toluidine blue, iodine, malachite green, TIM mnemonic. Are Wolutin granules specific to Corynebacterium diphtheria? No. They are seen in Corynebacterium diphtheria plus A long list in front of you. How do you write volutin granules? First alphabet, last alphabet, first alphabet, last alphabet. So please remember, G is gonna be for Gardnerella. S is gonna be for Spirillum. V ka hum thoda sa, we are gonna make a Y out of it. So that is gonna then become a yeast form. And N ka, we are gonna make an M out of it, and that is gonna be Mycobacterium TB. For that matter, I've also seen that Yersinia can also show you these volutin granules. तो एक और Y भी add कर सकते हैं, ठीक है? So that is how I have learned it. I try to make these छोटा mnemonics, but I try my best that the mnemonic should come from the name. Otherwise, ABCD gets all messed up in the paper. So volutin granules tells me that the G is gonna be for Gardnerella, S is gonna be for Spirillum, V ka we are gonna make a Y that is gonna help me with yeast and Yersinia, and N ka I'm gonna make an M, and that is gonna help me in Mycobacterium TB. Volutin granules done. So what were you doing? First you took the swabs, then you did a gram staining. After doing that, you did your full volutin granules ka study. And now let's come to the media. Enriched media, selective media. So look at this. Enriched 1, 2, 3, 4, 5, 6, 7, 8. 8 alphabets. So naam may be Loeffler media. Loeffler, count karo. Loeffler also has 8 alphabets. It is known as Loeffler serum slope. Remember, Loeffler is used as enriched media. And how much time does it take for the growth? It takes 6 to 8 hours. That is why I was emphasizing on 8. So remember, enriched has 8 alphabets. Loeffler has 8 alphabets. The time taken to grow is also 8 hours. So jaldi diagnosis ho jayega within 8 hours, less than half of a day. But if I talk about selective media, firstly, there's a long list. There is a McLeod media, Hoyle's media, Tinsdale media, and PTA. Maximum chances of getting a question are these two. They all mean the same, minor variations. Just note Hoyle's, McLeod, Tinsdale, PTA. What is PTA? PTA stands for potassium tellurite agar. PTA stands for potassium tellurite agar, and the rule is that whenever the word tellurite or tellurium will come, the color that you're gonna get is gonna be black colonies. The color that you get are black colonies because tellurium, tellurite is indicating black, and this is gonna take 48 hours for growth. So now listen to one PYQ. This is gonna be like very close in the paper. If I say I have a suspected case of diphtheria, bull's neck hai, pseudomembrane hai, I want an early diagnosis. Early diagnosis ke liye, what are you going to use? The 8 alphabets wala, Loeffler serum slope, because it takes only 8 hours to grow. But which is the best one? See, selective media will always be the best media. So if they ask you which is the best media for the growth, then you will say potassium tellurite agar, although it takes 48 hours. So that takes 8 hours, this takes 48 hours. Ho gaya, diagnosis ho gaya. Now some minor tests are left. 4 things that you have to know more. Is there any biochemical test that you can do which no one does and it's only for your memorizing? It is the His serum sugar test. There is something known as the His serum sugar testing that you do if you can learn this. But agla wala, don't forget. What are the toxins? How do I get to know that whether the strain has toxin or not? LX gel precipitation test. Guide, please note, in the beginning I told you some of the diphtheria will have toxigenic properties. Some of the diphtheria will not have toxigenic properties. This will not have. So how will I get to know whether my strain is toxogen or not? So now they ask you a simple question in the paper. LX gel precipitation test is done for knowing what? It is done for knowing the toxigenicity of the bacteria. What is the use of it? It is done for knowing the toxigenicity of the bacteria. So have a look at this picture, guys. The same picture I have taught you in immunology also. Please note that I have kept an agar over here. First, labelings dekh lo. What have you kept? You have kept a filter paper. What does that filter paper have? I have kept an antitoxin. So what did I do? I kept a filter paper over here, and in that first I kept an antitoxin. Okay. Now on top of that, I have kept 3 more filter papers. In one of them, I know I have kept Corynebacterium diphtheria, and I know that has a toxin. This is deliberately. This is not from patient. All this I am doing. I have kept an antitoxin in the center, and I have kept a toxin over here. Will I see a reaction? Of course. If there's an antitoxin and a toxin, the reaction to hoga. So you're going to see that this white color becomes the precipitin line. Antitoxin hai, toxin hai, precipitin line to dikhega. So you can see the precipitin lines over here because the toxin was there. Then I kept another filter paper. On that also I kept Corynebacterium diphtheria, but I deliberately kept a non-toxigenic. So now will you see the precipitin lines? No, I don't see any precipitin lines over here. No line. So ultimately I have made my own test. I have said line hoga to toxin hai, line nahi hai to toxin nahi hai. So line formed, toxin is there, line not formed, toxin is not there. Now I keep my patient sample over here. I don't know whether my patient has the toxin or doesn't have the toxin, but I saw that precipitin lines were formed with the patient sample. So batao, if precipitin lines are formed, if lines are present, this means toxin is present. So my patient has the toxin. Line present, toxin present, line absent, toxin absent. That is what is LX gel precipitation test. It tells you about the toxigenicity of the bacteria. Then like any other bacteria, you can do inoculation into guinea pig, wo sab mein kar sakte hain. And the last one is known as Schick test. S for S. Schick test is done to know the susceptibility of humans, of the person or of humans, whether a person is immune or whether a person is susceptible. So, ये पहले words देख लो. LX is done to know the toxigenicity, and S for S, Schick test is done to know the susceptibility. So, can you please recall for me that Schick test क्या होगा? Susceptibility means it's an intradermal injection. Toxin antitoxin का reaction. Okay, what did I have done in this? I have put an antigen, or in other words, I have put a toxin. Toxin का injection डाला. So let's assume, for example, that I have never ever had any diphtheria in my life. I don't have any antitoxin in my body. I don't have antibodies. I have never even been exposed to diphtheria. When you will suddenly inject toxin inside me, will I show you a reaction? Yes, ma'am, you didn't have any antibody, you did not have any protection. So suddenly you started showing a lot of reaction. So what does it show me? If you see a reaction, means if you see a positive Schick test, means you are susceptible. If you see a positive Schick test, means you are susceptible, means you don't have anyone to protect you, you are very vulnerable. On the other hand, if you would have injected toxin and patient aram se baitha hai, there is no reaction, you will say, Arey, this person is immune, he has antibodies, he has an antitoxin from beforehand. So if you get a negative Schick test, this means that the person is immune. See, the concept is clear, but in the exam we need rapid answers, 2 second mein answers dena, right? So that is what you're going to do with Schick. Spin the Schick. What is spin the Schick? If you get a positive test, it is susceptible person. If you get a negative test, it is an immune person. That is how you learn spin. Positive, negative, susceptible, immune. And on that note, you have wrapped up your diagnosis of the diphtheria. Diagnosis is wrapped up, but not the rest of the story. Do you know that beyond all of this, we are obviously left with a type of a treatment? पहले तो whether it is pharyngeal or it is nasopharyngeal or it is extensive disease with more than 3 days and neck disease, if extensive disease is there, in all of them, one thing that I will have to manage is droplet precaution, because this disease spreads with droplets. I will have to take droplet precaution. Second, I will have a set of antibiotics also, which is going to be penicillin or erythromycin depending on patient's tolerance. Penicillin or erythromycin antibiotics सारे situations में होगा, droplet precaution सारे situations में होगा. What is going to change is the real treatment, that is how much of diphtheria antitoxin is going to be given. You don't have to learn the exact numbers, but I'm just telling you, if it is a minor disease, means less than 3 days, pharyngeal hai, so you give a minor dose, like 20,000 to 40,000 units you can give IM or IV. ठीक है, छोटा dose दोगे. If it becomes nasopharyngeal, you need a little advanced dose, so 40k to 60k you can give, units you can give. But if it becomes very, very extensive, or if it shows you neck disease and more than 3 days ka involvement, if it becomes extensive, you will have to give 80k to 1.2, that is 80,000 to 1,20,000 units will be given. And sometimes they also say that half should be given IM and half should be given IV. That is also something they say. That is when you are considering an extensive disease or a disease that has bull's neck or a disease that is beyond 3 days. So, isme dosage also increases and half IM, half IV is given, right? So, I just wanted to tell you that the treatment is by the antitoxin. Antibiotics is same, penicillin or erythromycin depending on tolerance. And the adjunctive is definitely going to be droplet. But once this person is being treated, theek hai, ye bhi diya, ye bhi diya, ye bhi kara. During his recovery, what do? During the recovery, we give vaccines. Either we can give DTaP or we can give TDAP. What's the difference, ma'am? एक में D is capital, एक में D is small. Means when I have capital D, I have higher dosage of diphtheria toxin. I have higher dosage of diphtheria toxin. This is somewhere between 10 to 25 flocculation units. This is between 10 to 25 flocculation units. Whereas if I have a chota d, this means I have a lower dosage of diphtheria toxin that is present. I have a lower dosage of diphtheria toxin, right? So remember, for children less than 7 years of age, not only in convalescence, even when you're considering vaccination in a child less than 7 years of age, you will give the capital D, because less than 7 years ke age mein, you want to start the immune response. You want to activate the immune response by giving a higher dosage. Whereas in an older child above 7, you just want to boost the immunity. So for boosting the immunity, you do a lower dosage. So repeating, in a younger child, you give a higher dose, and in a higher or an older child, you give a lower dose. That is what you follow. All said and done, one last thing. I was focusing only on Corynebacterium diphtheria. I'm still focusing on Corynebacterium diphtheria. But based on what was the selective media, guys? Potassium tellurite agar. There can be a biotyping. Further types of Corynebacterium diphtheria can be said. Very tough to learn. I have learned GIM. GIM means gravis, intermedius, mitis. ठीक है? अब tell me, someone who goes to the gym, उसके head पे पूरा time क्या रहता है? Either that person is always thinking about protein, है ना? Someone going to the gym, listen to me carefully. Someone going to the gym, in his head, it will always be eggs खाना है, protein खाना है. So means gym जाना मतलब gravis, intermedius, mitis. Gym is done. Head means the first one shows you daisy head colonies. And egg means go in alphabetical order. One shows you frog egg colonies, one shows you poached egg colonies. So F पहले आएगा, P बाद में आएगा. Simple. People who go to the gym, gravis, intermedius and mitis, in their head, that is daisy head, they have egg, that is frog egg and poached egg. Okay. Which of them is minimalistically virulent? नाम में ही है, minimalistically virulent. Mitis is said to be the least virulent organism, minimalistically virulent. Mitis, minimal. Which of them is going to show you starch fermentation? Which of them shall show you starch fermentation? So you will say, ma'am, starch matlab carbohydrates. Gym जाने वाले बंदे के लिए, for a person who's obsessed with gym, starch and carbohydrates तो बिल्कुल भी नहीं. In his head, what else does he have? That ferment the starch. So another thing in this person, it's grave. He says that it's grave for me to have starch. Ferment the starch. So gravis shows you starch fermentation. That's in his head. That starch nahi karna. Now the only property left, they will ask you which of these is the only one which is non-hemolytic. So non-hemolytic is going to be intermediate. So one property of each. They ask you least virulent, minimal virulence, mitis. They say whose grave starch is going to be grave for whom. So starch fermentation is by gravis. And intermediate is the one that is left, that is non-hemolytic. So remember, person goes to the gym, uske head mein egg is going to be there. That is the biotyping based on growth of potassium tellurite agar. Are you ready for some questions? Corynebacterium species that causes erythrasma. Now what was it? The red color rash. Which one? Corynebacterium minutissimum causes red rash. And what is the wood lamp examination? It is going to be the coral red fluorescence on wood lamp examination. Which of the following Corynebacterium species are lipophilic? Lipophilic ke liye I told you everyone was non-lipophilic except for two. Jacium and Urea liticum. Do you also know what do they cause? Jacium was causing prosthetic valve endocarditis. Urea wala organism was causing struvite stones in the kidney, right? Okay. On the same, let's proceed forward. The Corynebacterium associated with prosthetic valve endocarditis, we just told you Corynebacterium. Jacium causes it. Next one. Which of these is Praesnochard bacillus? I gave you a mnemonic. Pehle batao, Praesnochard bacillus, Corynebacterium pseudotuberculosis. I said take the P, take the S. P for Praesnochard bacillus and S is going to be for involvement of the sheep. Coming to the next. The mechanism of action of the exotoxin produced by Corynebacterium diphtheria. What does it do? Ma'am, this was coming under decreasing protein synthesis. How does it decrease the protein synthesis? By acting on EF2 by the ADP phosphorylation. One last question that we have. True about Corynebacterium diphtheria are all except. Let's do a true, false, true, false. Is it production associated with lysogenic conversion? Yes, A, B, C, D, E. Are they non-sporing, non-capsulated, non-motile? Yes, सब कुछ non था. Is the toxin responsible for a local reaction? Yes, I've seen that in Schick test. Iron has no role in toxin production. No, iron definitely has a role in toxin production, and that is what we had studied. So that is the wrong statement that you have over here. Actually, there's one more question after which we'll wrap up. A 12-year-old child presents with fever, cervical lymphadenopathy. Oral examination shows a gray membrane on the right tonsil. Which of the following, so क्या diagnosis बनाना है? There's a child with a membrane. I've made a diagnosis of Corynebacterium diphtheria. Which of the following will be ideal for earliest diagnosis? They've not asked you the best media, they've asked you early, वो 8 hours वाला media. तो जो enriched 8 alphabets थे, those were Loeffler, which was 8 alphabets, and that is going to take roughly 6 to 8 hours. So Loeffler serum slow is going to be the answer over here. So I hope all of you have understood Corynebacterium diphtheria. We are going to actually move ahead and we are talking about that McDonald mnemonic. So diphtheria, diphtheroids are a big tick mark. I'm now going to move on to the next and we are going to finish off these set. Nocardia, actinomyces and listeria. Let's wrap up these three. Having completed the diphtheria and the family, we are now going to move on to the other gram-positive bacilli and they include these three. Nocardia, actinomyces, listeria, of which Nocardia and Actomyces will be taken together because they come under the filamentous organisms. Now, before I start with these gram-positive filamentous organisms, like I told you, Nocardia and Actinomyces, I want to tell you a nice little story. Seems to be something like what we used to read in our storybooks. This is nature. You will be learning Nocardia as nature. What are the good things that nature gives you? Nature has given us the good things like oxygen. It has given us good things like soil. And then there are certain bad things which we have had forced the nature to give us, like carbon, like acid rain, right? So because of human activities, a lot of these things are also forming. And that is what is Nocardia. So now if I ask you, what are the good things that nature has given you? Your first answer is that Nocardia is going to be nature. And that is a strict aerobe, means it requires oxygen. So the good part about nature has been mentioned. The second good part was that the soil, yes, Nocardia is exogenous. It is present in the soil. It is never inside our body. It is not a commensal or a habitant of our body. It is not endogenous. It is exogenous. So oxygen ho gaya, soil ho gaya. The next thing that you will ask me is what are the bad things that nature had? So Nocardia, number one, had acid rain. Acid rain basically means, writing the mnemonic side by side, acid rain means it is acid fast, 1% acid fast. So have a look at this picture. Look at this. I just told you that Nocardia is a gram positive. So matlab, yes, gram positive means purple. And I said it is a filamentous organism. So of course I can see the filaments also coming nicely out of it. But then I'm saying it is 1% acid fast, which means what is the stain that I'm using? The Zn stain. And you can see on Zn stain, we always get a red color organism. So that entire clump has become red. That is what we have for Nocardia. So one bad thing of the nature we've done the acid rain. Now we'll do the second bad thing, and that is going to be carbon. The second bad thing of nature is going to be carbon. So please remember that Nocardia says that I need carbon. So Nocardia says if you want me to grow, you will have to give me carbon. So what will I do? I will do culture with paraffin bait technique. Do you guys know what is bait? Like for example, when you go fishing. For fishing, you put a little bit of food, then only the fish will get attached onto the hook and you will be able to fish it out. Similarly, like for example, if I have to teach you microbiology and if I say that, you will say, ma'am, if you tell us mnemonics, then only we are going to come and listen to your class. Otherwise, we are not coming for microbio class. So mnemonics are a bait that I am giving to you, that if I give you mnemonics, you will listen to microbio. Similarly, if I give carbon, Nocardia will grow. You know what is the source of carbon? Paraffin is a source of carbon. So point number one, please remember that paraffin is a source of carbon, and that is exactly how we are going to give it paraffin. By giving it paraffin, we are giving it carbon and then it will grow. So we are done with the bad things also. So simple, Nocardia story ho gaya. The good things were that it requires oxygen, it requires or it's present in the soil. The bad part of nature was acid rain, so it is 1% acid fast, and secondly the bad part is carbon, so it's going to be grown on paraffin bait technique. But karta kya hai? What exactly does it do? We have two set of people. One are immunocompetent, good, and one are immunocompromised. So when I'm talking about the immunocompetent and the immunocompromised people, let's get going with this one by one. So please note that when I'm talking about the immunocompetent people, well, fit and fine, usually it results in a cutaneous manifestation, right? There are cutaneous ulcers and sinuses that are formed. But when I'm talking about an immunocompromised person, usually it involves the lungs, and if not the lungs, then it will involve the brain. So usually the lungs, and if not the lungs, it will involve the brain. So these organ involvements are seen in immunocompromised people, but in immunocompetent people, we usually tend to see cutaneous involvements. Fine. All of this is done. If you've done this, actinomyces is now going to be completely opposite. Remember, if nocardia needed oxygen, actinomyces is going to be a strict anaerobe. If nocardia was exogenous in the soil, actinomyces is endogenous. It's present in the mouth flora. It's normal in the mouth flora. If nocardia was that acid rain, acid fast, then actinomyces is going to be non-acid fast. Next, if nocardia needed that carbon bait, actinomyces says no. Actinomyces says everything about me is the mouth. Remember, when the word actinomyces comes, the word mouth comes. So what is the normal commensal? It's normally present in the mouth, point number one. What kind of colonies is it going to show you? Look at this. It's going to show you the molar tooth colony. So have a look at this picture, guys. Firstly, where is actinomyces going to be present? It's going to be present in the mouth. And secondly, look at the colony. Such beautiful, cute little molar teeth have been drawn over here. It's one of the cutest colonies that you'll find. So actinomyces is everything to do with the mouth, be it molar tooth or be it the actinomyces in the mouth. So now you will ask me, what all infections does it cause? There are different types of actinomyces that you have to know. Till now, what you've been reading, mouth wala, is the orocervical. Orocervical means it's going to involve the jaw, the cervix, the neck, cervical neck region, and the mouth. This region is going to be affected, and that is referred to as the lumpy jaw. So what is lumpy jaw going to show you? Lumpy jaw is a situation where you will see swelling of the jaw, and there will be sinuses. There will be multiple sinuses from which the discharge will be coming out. And you know what kind of discharge will come out? Another S. There will be sulfur granules. There will be sulfur granules that you will be noticing. So repeating, what all is present? There will be a swelling in the jaw, there's going to be sulfur granules, and there is going to be sinuses that are draining it. That is if the orocervical region is affected. Then keep going down. Thoracic involvement can occur. Abdominal involvement can occur, probably following some surgery. Following some kind of surgery, this can definitely be an involvement that you can see. And finally, pelvic. Where pelvic involvement? Actinomyces, pelvis. Guys, have I given you an example in pathology of a female using intrauterine contraceptive device and then landing up with actinomyces? Yes, and this is the histopath which is in front of you, be it in any location, orocervical, thoracic, or abdominal, or pelvic. This is how actinomyces looks like. So if you zoom in, yes, it is a gram-positive purple color ka filamentous organism. So the first part is seeming right. I can very well see that there is a gram-positive filamentous organism that is going to be present. But what around it? If you look carefully, there is a pinkish zone around it. Again, if you can zoom in, you will see that there is a pinkish zone around it. You know what is this known as? This pinkish zone is referred to as the Splender-Hopley phenomenon. This is known as, and the same thing I have taught you in somewhere else also, in path also, and in micro also somewhere else. So this is the Splender-Hopley phenomenon. And what is it indicative of? It is indicative of an antigen-antibody reaction. So wherever antigen-antibody complexes will form, there this pink color row, Splender-Hopley phenomenon will occur. Guys, where else have I taught you? In micro only, in mycology, fungus wala chapter I have taught you. Splender-Hopley phenomenon is also seen with Sporothrix schenki. Over there I told you that Sporothrix and actinomyces. Here I am telling you Sporothrix and actinomyces. So the story is done. Splender-Hopley phenomenon, pink color line indicative of antigen-antibody reaction. So coming all the way back, I think everyone has identified the differences that you have. Yes, this is going to occur in the jaw. Yes, this is going to have an orocervical actinomyces. I told you the SSS, the swelling with the sinuses and the sulfur granules coming out. All of it is done. We are only left with the treatment aspect of it, and that treatment is learnt by a mnemonic SNAP. What is SNAP? So that you don't get confused. SNAP basically means that if you are dealing with a case of nocardia, or you are dealing with the case of actinomyces. Pehle write the name of the organism. Okay, Nocardia and actinomyces. Now leftover alphabets. So for Nocardia you have sulfonamides, and for actinomyces you have penicillin. So in the exam, whenever you get confused, pehle write the name of the organism. Nocardia and actinomyces. Nocardia ke liye it is going to be sulfonamides, and actinomyces ke liye it is penicillin. All said and done, before I end, can they occur together? Yes, they can. That is known as actinomycetoma. So remember, actinomycetoma can be a combination of Nocardia and actinomyces occurring together, which looks very similar to the Madura foot or the mycetoma foot. Of course, these are all bacteria, guys. Can there be any fungus also that can cause it? Of course, we have read so many fungal organisms like Madurella, which can cause a similar situation. So now you know how to differentiate. This set is going to be a set of bacteria, gram-positive filamentous bacteria. The other set which can cause it is fungus. So you have to look at it under the microscope and identify. One last thing, there is one actinomyces that you have to know, that is Actinomyces israeli. So first and foremost, when I say Actinomyces israeli, so it has a lot of I's in it, Israeli, hai na? So this is the one that you usually see with I for IUCD users. And this is the one that is going to result in pelvic inflammatory disease. Okay? So IUCD users, pelvic inflammatory disease, and remember they have always learnt it as Israel has yellow color sand. That is the mnemonic which is very much followed in USMLE books. Israel has yellow color sand, and yellow color sand basically means that there are going to be what color granules that will come out? There will be yellow sulfur granules that you are going to see in these patients. One last thing, tell me, out of Nocardia and actinomyces, which was acid fast? You had said Nocardia nature wala tha, acid rain wala, nature wala was Nocardia. Nocardia was acid fast, actinomyces was not acid fast. Can Actinomyces israeli be acid fast? Sometimes yes. So for this Israel, I've got a lot of things. Sometimes it can have acid rain, sometimes it can have yellow sand. Okay, Israel mein kabhi nature changes can happen. Sometimes it can be acid fast, sometimes it can have yellow granules, and because it has so many eyes, this is seen with IUCD users and with pelvic inflammatory disease. So I hope you'll remember the story of the nature, oxygen, carbon, acid rain and soil, and if you are done, you will be able to finish this very quickly. Moving on to the next organism. The next one that we have is Listeria monocytogenes. Another amazing story that I'm going to tell you. We are learning Listeria monocytogenes with the mnemonic. You know, Listeria is Tully. Tully means Listeria seems drunk. Listeria is one of the drunk organisms. And when I say someone is drunk, tell me when someone is drunk, can you help him say A, B, C, D, E, F, G? He will always start stammering, or he will start making mistakes. He will, because he's so drunk, he can't say even ABCD. So Listeria is that drunk person in which ABCD wala test we are going to take for him. So first I'll tell you the mnemonic only. After that, so the story becomes easy. I know the mnemonic is very congested, but it's actually going to give you the best overview of Listeria. So firstly, if someone asks you what is the toxin or what is the virulence factor, common sense, Listeriolysin O. Common sense, okay. What is Tully? You know, this Tully means it shows you tumbling motility. It tends to fall here and there like a drunk person. So it shows you tumbling motility, and it is going to be tumbling at 25 degree but not tumbling at 37 degree. Why? Because at 25 degree, it produces a flagella called peritrichous flagella. How do I learn it? See, now abhi to all of you are young. Young mein to you can easily get drunk at the age of 25 years and it's not going to bother you much and your health. But the same thing, if you get drunk at the age of 35 above, it is going to bother your health and your liver a lot. Even though now it will bother your health, but right now you will not bother much about it. When you come to a 35 plus age, then you will start wondering and worrying about your health. So remember, at 25, so it is tumbling and drunk, but at 37 degree, it is not tumbling and not drunk. So that is the T for Tully, drunk, tumbling motility. What is A? This tends to show you an Anton test. What is an Anton test? I'll tell you in a while. B for it shows you beta hemolysis. C for how does this happen? Everything possible. Either you come in contact with some animal, or you have contaminated food, or you have cheese. This is very commonly seen with soft cheese. Also, this tends to grow at 4 degrees. It shows you cold enrichment. So cold food, refrigerated food is the history given. This shows you 2 C tests, that is CAMP and catalase positive. Next, patients are going to come up with diarrhea. How are you going to do the diagnosis? E for ELISA. F I've already told you flagella hota hai, but flagella at 25, not at 37. And this is very commonly seen in something to do with F for female wala conditions, like listeria infection will occur in pregnant females. It can, pregnant females mein abortions kara dega. Neonates mein it can cause neonatal infection. And finally, so F say female and their children problems I have kept. G for I have kept, it causes specially something in children called granulomatous infantisepticum. So infanti will tell me bacche. G for granulomatous. And now when I go from G back to A, the A and G tell me the treatment. It is treated by ampicillin plus gentamicin. Beautiful mnemonic, isn't it? It took me almost half an hour to make it. So this is the Tully A, B, C, D, E, F, G. And now if you've done this, rest of it you just have to listen to me quickly. What kind of motility does it have? You will say, ma'am, it has a differential motility, tumbling motility, and you are saying that it is going to be moving around and tully at 25 years of age, but not tully and not tumbling at 37 years of age. So motile at 25 degree, not motile at 37 degree. Why is it motile? Because of a peritrichous flagella. Next, if I ask you that what are the modes of spread, you had said all the CCC. Either it is by contact with animals, or it is by contaminated food, or it is by consuming all the cheesy products. All the CCC were the spreads. Now, when I ask you what is going to be the virulence factor, I have already told you it is listeriolysin O, and listeriolysin O is going to show you beta hemolysin properties also. So B was for beta hemolysis. Now, if I ask you what are the clinical features, I told you na, D said diarrhea. This patient is going to have diarrhea. And F say I told you all the female and unke bachchon wala problem. So females may of course pregnancy, it will result in stillbirth, abortions, premature rupture of membranes, and unke bachchon wala problem kya hai? Bacche will have sepsis, meningitis, and G say I told you bachchon can have granulomatous infantisepticum also. So that mnemonic is beautiful. How do you do the lab diagnosis? Again, what sample will you take? That will depend. A problem किसमें है? Is the female having a problem, cervical, vaginal, or is there a child having a problem, cord blood, meconium, बच्चे में meningitis है, you take CSF. So whatever the patient has a complaint, you take a sample. What hemolysis? B से क्या था? It shows you beta hemolysis. Then I told you at what temperature is it gonna grow? I told you cold enrichment. It tends to grow at 4 degrees. Let me tell you a story. I don't know how many of you read about it, but a very famous frozen yogurt chain was shut down in America because frozen yogurt, of course, it's at low temperatures. They found that listeria growth was seen. Listeria growth was noted in that frozen yogurt chain, and then they had to shut it down all pan America. So because this tends to grow at a cold temperature. Also, they will say that there is a mother who's cooking food and she was heating food. So she took the food out of the refrigerator. She just tasted it. Before heating it, she tasted it, and then she ended up heating the food and giving it to her family. So when the family ate food, the food had been heated. So the family did not have any problem, but she had taken it out of the refrigerator and had a bite before heating it. This means she will have a problem. So this 4 degree wala story is very interesting. So C for cold enrichment. What C? I also told you it is CAMP test and catalase positive. CAMP test you have also done somewhere else, guys. Finally, the story is done. Remember gala camp? I told you gala camp, you're going to have a gala time in the camp. Now that gala mnemonic is firstly agalacti. We had said streptococcus agalacti is going to show you the camp test, and now this listeria is also gala time, Tully and gala time. So this listeria also shows you camp test. Okay, next it is catalase positive, fine. Then it is A for Anten test positive. Now you will ask me what is Anten test? Anten test is something in which you will take an Anten test, is basically An for animal. It is an animal test in which you are going to take the rabbit's eyes and you are going to put this listeria into it. And this rabbit eye will end up having not just conjunctivitis for that matter, you will end up having keratoconjunctivitis. You will end up having keratoconjunctivitis in the eye of this rabbit. Is this similar to what you have studied, or maybe you're gonna study in the future? You're also gonna study something known as the Sereny test. And Sereny test, as I say, Sereny test is done for enteroinvasive E. coli. Enteroinvasive E. coli shows you Sereny test. Usme bhi same hai. Rabbit ke eye mein you will inject and you will get keratoconjunctivitis. So remember, some animal eye you will take, you will inject listeria and get keratoconjunctivitis. That is known as Anten test. If you inject enteroinvasive E. coli and get keratoconjunctivitis, that is Sereny test for E, eye wala. Finally, with E, I had told you the serology that we use is ELISA, what is the treatment that I told you? The A and G. You were gonna give ampicillin and gentamicin. Guys, so ultimately I realized the rest of the story was so useless. If I have done this Tully A, B, C, D, E, F, G, it is so nice. Do you want to repeat it? Yes, so Tully tumbling at 25 degree, not at 37 degrees. So 25 ki age mein, but not at 37. Okay, why? Because there is a peritrichous flagella that is formed. A for anten test, वो animal वाला test. B for beta hemolysis. C for what all? How does it happen? Contact with animals, contaminated food, cheese, especially cold temperature 4 degree story, very important. Camp test positive, catalase positive. Patients have diarrhea. Patients are also going to be females with problems in their pregnancy. There can be problems in bachas, that is neonates. There can be granulomatous infanti septicum. For the diagnosis, I will use E for ELISA, and for the treatment, I will use ampicillin and gentamicin. The toxin that is produced is listeriolysin, and that is the end of Listeria monocytogenes. I hope you found this beneficial, the story of nocardia, actinomyces and listeria.